Yesterday, we studied the bony features of ilium part of hip bone. Today, we shall be studying the bony features of its second part, which is the pubis. Pubis is the part of the hip bone that lies anteriorly, or more precisely, antero-inferiorly. This part of the bone also forms the pubic symphysial joint with its counterpart of the opposite hip bone. So bony features of the hip bone pubic part include its body and two rami, a superior ramus and inferior ramus. The body of the pubis is a thick bar of bone that forms the pubic symphysial joint with the body of the pubis of the opposite hip bone. It presents a sharp superior border called the pubic crest. Lateral to it is a circular small bony projection called pubic tubercle. This pubic tubercle is of great clinical significance, and it's a very, very important landmark in the region of pelvis. Body of the pubis has three surfaces: anterior, posterior, and medial. Medial surface of the body of pubis is the one that forms the joint, pubic symphysial joint, with the symphysial or the medial surface of the opposite side of the pubis of hip bone. Medial surface of the body of the pubis hence has another name called symphysial surface, in reference to the joint it forms with its counterpart. Next surface of the body of the pubis is anterior surface. Anterior surface of the body of pubis is directed forwards, as the name is self-explanatory, or in an intact pelvic girdle, we can call this surface as outer surface too. Posterior surface is the one that faces backwards and slightly upwards. It is relatively smooth as compared to other two surfaces, and it has another name called the pelvic surface because it faces the interior of the pelvis. So the body of the pubis has three surfaces: anterior, also called outer surface, this one, that faces anteriorly or that is directed forwards. Then it has a posterior surface, which has another name called pelvic surface because it faces the pelvis. Secondly, this surface is directed backwards and slightly upwards. And then we have a medial surface. Medial surface is slightly rough because it is going to form the symphysial joint with the symphysial surface or the medial surface of the body of pubis of the opposite hip bone. Moving on to the rami of the pubis. The pubic bone has two rami, a superior ramus and an inferior ramus. Ramus is usually defined, the word ramus is usually defined as an extension or division of a structure. So from the body of the pubis, two divisions or two extensions come out. The one that is directed superiorly is called superior ramus. Here in this diagram, you can see it is colored yellow. The inferior ramus, the name is indicating, it is directed inferiorly. and downwards as compared to superior ramus. And here in this diagram, it is shown red. Starting with the bony features of the superior ramus has three borders. It has a superior border, an anterior border, and an inferior border. So superior ramus has three borders. A superior border, also called pecten pubis, also called pectineal line. It has three names: superior border, pecten pubis, and pectineal line. Second border is called the anterior border, this one. It is also called obturator crest. Third border of the superior ramus is inferior border, here shown in this diagram. Superior border, also called pecten pubis, also called pectineal line, extends from behind the pubic tubercle, extends upwards till it reaches the area of iliopubic eminence. The anterior border, which is also called obturator crest, is a sharp ridge-like border or margin that also extends from behind the pubic tubercle and moves backward till it reaches the acetabular fossa and its notch, acetabular notch. Third border was the inferior border. This border of superior ramus forms the upper margin of obturator foramen. Next, we have its surfaces. The superior ramus has three surfaces: pectineal surface, pelvic surface, and obturator surface. Pectineal surface of the superior ramus is the one that lies between the superior border and the anterior border, also called obturator crest. So this surface is the pectineal surface. Next, we have the pelvic surface. Pelvic surface is the one that lies between the superior and inferior borders. So this is the pelvic surface. Pelvic surface, again, the name is indicating, is the surface that faces the pelvis, and it is relatively a smoother surface as compared to other surfaces. Third surface is the obturator surface that lies between the anterior and inferior borders. So here is the obturator crest, and this is the inferior border. So this is going to be the obturator surface of superior ramus. The second ramus of the pubic bone is inferior ramus. And this ramus is going to be explained with the ramus of the ischial bone, because these two rami, the inferior ramus of the pubis and the ramus of the ischium, unite to form a conjoined ramus called the conjoined ischio-pubic ramus. Next, we have ischium. Ischium has a body and a single ramus, which I just mentioned earlier, that it joins with the inferior ramus of the pubis to form the conjoined ischio-pubic ramus. So ischium has a body and a conjoined ischio-pubic rami. The body has two ends, three borders, and three surfaces. The body of the ischium is quite big, strong, and massive, and it lies just below and behind the acetabular fossa. It has two ends, an upper end and a lower end. The upper end of the body of the ischium forms the 2/5 of the acetabulum. So this entire part is the upper end of the body of ischium. Lower end forms the ischial tuberosity. This big, thick, and strong part of the ischium is called ischial tuberosity. A very interesting fact about the ischial tuberosity is that we sit on this ischial tuberosity. And from this ischial tuberosity extends a ramus, which joins the inferior ramus of the pubic bone to form the conjoined ischial-pubic rama. So, upper end, which forms the posterior 2/5 of the acetabulum, and a lower end of the body of ischium, which forms the ischial tuberosity. The body of ischium has three borders. Anterior border, which forms the posterior border of the obturator foramen. So this whole, this upper part, is the anterior border. Posterior border is the one that is going to be continuous with superiorly or above with the posterior border of the ileum, which we know from our previous lecture that it extended from the posterior superior iliac spine, continued downward till it reached the ischial tuberosity, where it is going to be continuous with the posterior border of the body of ischium. On its way, the posterior border presents various landmarks. It shows a greater sciatic notch. Then in the lower part, it shows a sharp bony projection called ischial spine. And below that projection, we have a smaller depressed area called lesser sciatic notch. Next border is the lateral border of the body of the ischium, which forms the lateral margin of the ischial tuberosity. The body of ischium has three surfaces: the femoral surface, dorsal surface, and the pelvic surface. Femoral surface lies between the anterior and the lateral borders. This is the lateral border, and this one is the anterior border for the body of the ischium. So this surface is going to be the femoral surface. Dorsal surface of the body of the ischium is the one that is shown to be continuous with the gluteal surface of the ileum. So basically, it is a convex surface that lies in the adjoining area of the acetabular fossa, this one. Then this surface is also including the upper part of ischial tuberosity. Pelvic surface is the one that forms part of the lateral wall of true pelvis. This is the pelvic surface for the ischium. Again, the surface that faces interior to the pelvis. Along with the body of the ischium, there are some few points regarding or bony landmarks related with the ischial tuberosity. Here in this diagram, you can see that ischial tuberosity is divided into an upper part and a lower part. Upper part and a lower part by a transverse line. Whereas the upper part is further divided into two parts by an oblique line and the lower part by a vertical line into two parts. The upper part, which was divided by the oblique line, has two parts, a supralateral part and an inframedial part, whereas this is the lower part, which is divided by a vertical line into an outer and inner area. Outer and inner area. Here is another diagram showing the ischial tuberosity, which is divided by a transverse ridge into an upper part and a lower part. The upper area is divided further by an oblique line into a supralateral and inframedial parts, whereas the lower area is divided by a vertical ridge into an outer part and an inner part. Now some important bony points related with the conjoined ischiopubic rami. As we mentioned earlier, that extension from the ischial tuberosity is called the ischial ramus, which joins with the inferior ramus of the pubic bone to form a conjoined ramus called conjoined ischiopubic ramus. As you can see in this diagram, it has two borders, an upper border and a lower border. Upper border forms a margin of the obturator foramen, and lower border, which is also quite thin and sharp, forms part of the pubic arch. Two surfaces, inner and outer. So here, this is the inner surface and this is the outer surface. The inner surface has some visible lines which divide the area, that is the inner area of the ischiopubic ramus, into at least three parts by two ridges, upper, middle, and lower parts. The outer surface is simply rough because of the attachment of different structures, especially muscles. There is a bony landmark worth mentioning here, along with the bony features of the hip bone. You will read a term called arcuate line in your books regarding lower limb. Do not confuse it with the arcuate line in the abdomen. Arcuate line over the hip bone is a line that starts from below the iliac fossa. As you can see in this diagram, arcuate line is continuous superiorly with the medial border of the ilium, whereas inferiorly it is shown to be continuous with the superior border, also called pectineal line, also called pecten pubis, of the superior ramus of the pubic bone. This line is called arcuate line. Below, it runs inferiorly and anteriorly and becomes continuous with the superior border of the superior ramus of the body of the pubis, and together the superior border, also called pectineal line, and this arcuate line, together these two lines are called the iliopectineal line. In this diagram, you can also see this is the line. Above, it is continuous with the medial margin of the ilium, and below the iliac fossa, it runs inferiorly, anteriorly, to be continuous with the pectineal line of the superior ramus of pubic bone, And together, pectineal line and the arcuate line are called the iliopectineal line. Another term related with the ischiopubic rami of the two hip bones, right and left, is the pubic arch. I just mentioned earlier that the inferior border of conjoined ischiopubic rami forms part of the pubic arch on each side of the midline. Pubic arch is defined as a part of the pelvis, which part of the pelvis? The inferior border of the conjoined ischiopubic rami of the two sides. They converge at an angle below the pubic symphysis. And the angle they form is called subpubic angle. So pubic arch is formed by the inferior borders of the conjoined ischiopubic rami on two sides. And these two borders, they converge at an angle, which is called subpubic angle, below the pubic symphysis. So in this lecture, we have completed the bony features of the hip bone. And in the next lecture, inshallah, we shall cover the attachments, ossification, and planicles of the hip bone.